Hello everyone, welcome to Apti Plus Academy for Civil Services. It's a video on daily news and editorial analysis, which I'll be covering from the Hindu and Indian Express. The important news and editorial that will be relevant for the preparation of civil services examination will be discussed in this session. Let's get started with the news topic list. Today is 4th of March. The first important news, that is select central government staff can opt for OPS, that is old pension scheme. World Bank to support India's healthcare sector. There are two news coming from the World Bank. The other is World Bank report on freedom at workplace. The second last news is US blames India firm for Curve Syrup death. We'll see the detail about the cases. And the second last is an editorial, clean tech as a next big thing in the rural India. Apart from the news and editorial discussion, at the end of this video, there will be MCQ based questions. These questions will be based on current affairs that will help you for the upcoming prelims examination. So without any further delay, let's get started. And before I begin this session, those of you who are new to our channel, do not forget to subscribe Apti Plus Academy for Civil Services on YouTube. If you like this video, if you find this video informative and helpful for examination purposes, do press a like button. And inform you about the prelims marathon 2023. Today is a day where you can register. The last day. We're starting from 5th of March. All India open mock test that will give you an added advantages if you're appearing for the prelims 2023, where the questions are strictly designed on the parameters of the UPSC in accordance to the syllabus, which include both General Studies Paper 1 and General Studies Paper 2. For the aspirants, there are exciting offers. The top ranker will be getting the part of test series and IAS Gazetted magazine free of cost. And there's a cash prize which will be also there. So do check it out. Those of you who have not registered yet, do find the link in the description section and register yourself to avail the benefit of Prelims Marathon 2023, which is an all India test and an all India ranking will be provided. Now, moving to the news of the day, that is select central government staff can opt for old pension scheme, that is OPS, right? So this was something which was removed from the central government employees when the NPS was there. We'll see what government has actually decided. Important for General Studies Paper 2 under the subtopic, that is government policies and intervention for the development of various sectors and issues arising from a design and implementations. So in a major move, central government ने decide किया है that they will be coming up with one-time option for select central government employees to migrate to the OPS, that is old pension schemes, right? Currently, Government of India is availing with the new pension schemes, but कुछ relaxations दी गई है कुछ staffs को. According to the latest notification, which was there by the Ministry of Personnel Employment and Grievances, right, that those employees who join the central government services, which was advertised in December 2003, are eligible to join the old pension scheme under the Civil Services Pension Rule 1972, which is now the 2021. The new pension scheme called as NPS was notified in 2003 and finally the implementation has started from 1st of January 2004. So जिन लोगों ने 2004 के बाद ज्वाइन किया है उन्हें OPS की benefit नहीं मिल रही है, that is old pension scheme. They have been converted into new pension scheme. The benefits are accordingly available. So the option is available to the central government employee enrolled under the NPS as they join the services after 1st of January 2004. Now what is the major changes? This is there in the newspaper although. कुछ basics की बात करते हैं old और new pension schemes में. So the scheme guarantee lifelong income post-retirement, right? And government bears the expenditure, that is income. And under the scheme, a monthly payment is assured where an amount is equivalent to 50% of the last salary drawn. So this is again something very important which has been operating in India, but NPS के बाद ये चीजें change हो गई है. NPS में there is a participatory scheme where employee contribute to their pension corpus from their salaries matching with the contribution with the government, right? And the fund is invested in a market through the pension fund manager. So it is being invested in the security market and other trading market where the benefits is given and shared between the government and the employee. On retirement, 60% of the corpus is tax-free, which is withdrawn with the remaining 40% invested in annuity, which is taxed, right? तो ये bifurcation है NPS और old pension scheme में. There can be a direct question in UPSC prelims examination asking you the difference or the features of the NPS and OPS. Now, who all are eligible for the old pension scheme as per the recent notification by the Government of India? So according to the central government order, it will be applicable for the employees of the central government services those who have joined 22nd December 2003 से पहले जिन लोगों ने ज्वाइन किया उन लोगों के लिए एलिजिबल है. And even it will be applicable for the central armed police forces personnel, and it may be exercised by the government servant concerned latest by August 2023. तो ये टाइम रखी गई है, डेडलाइन रखी गई जहां पे सारे लोगों को अपनी ऑप्शंस चूज करनी है और फाइनल सबमिशंस करनी है, राइट? So this is the timeline upon which individual will be given to opt for either OPS or for NPS. The move can follow various references in the court decision in this regard. कई बार सुप्रीम कोर्ट ने भी इसको लेकर के कई बातें कही हैं. The government servant who want to be eligible for this option but do not want to exercise within the stipulated time, they will be considered that they are preferring NPS. तो जिन लोगों ने 31st of August 2023 तक registered नहीं किया है, they will be considered that they are the part of the NPS. So it is very important, if you know someone, just make them aware that these are the decisions that government has taken. If they want to convert, they can proceed further till 31st of August 2023. Stakeholders response की अगर बात करें, what was the stakeholder response? The National Movement for Old Pension Scheme is an umbrella body for more than 40 lakh central and the state government employees has actually welcomed the government decision, and the Department of Pensions Welfare held an extensive consultations with the Ministry of Finance, Law, Department of Expenditure, Personnel, and reach out to a consensus where they allow to switch to the OPS from the National Pension Scheme. So let's see, on a nutshell, many people were actually looking for this option. I think most of will go for the OPS because there's no capping on the amount that is withdrawn and there's a fixed amount that will be given by the government to an employee. Now, total employee under NPS till January 31st, 2003, a total of 23,65,693 employees are there, and state government की ये numbers है जो कि enroll हुई है national pension schemes के अंदर. Except West Bengal, all states have implemented the national pension scheme. So this is factually important for your prelims examination and those of you who will be appearing for OPSC and other WPSC examinations. World Bank to support India's healthcare sector, something important for General Studies Paper 2 under the subtopic that is issues related to development and management of health. So India and World Bank has signed two complementary loans, and each one is valued at 500 million, so total of 1 billion, to support and enhance country's healthcare infrastructure. We have seen that during COVID-19, the healthcare structure has mostly collapsed. There were basic facilities and amenities that was essentially required was not there in the country. तो इसमें बहुत ज़्यादा रिफॉर्म लाने की जरूरत है. वर्ल्ड बैंक के असिस्टेंस के थ्रू बहुत सारी चीज़ों को चेंज की जाएगी. The combined financing of 1 billion, which is equivalent to 8,200 crore rupees, the bank will support India's flagship program, that is Pradhan Mantri Ayushman Bharat Infrastructure Mission. It's a very important mission. There can be a direct question in prelims examination, right? तो इस मिशंस को ऑगमेंट करने के लिए, फर्दर इंप्रूव करने के लिए इसमें कुछ ट्रांचेस दिए जाएंगे टू इंप्रूव द पब्लिक हेल्थ केयर इंफ्रास्ट्रक्चर अक्रॉस द कंट्री. Now, another 500 million enhanced health services delivery program will support government efforts to strengthen the service delivery through redesignated primary health model, which will include some of the important part, that is like improved household access to primary healthcare facility, जो कि एक आज की डेट में काफी ज्यादा जरूरत है. Even if you see rural area, they do not have facility of this. So this will be improved. Strong links between each household and primary healthcare facilities through regular household visit. So there will be individual who will be assigned to look into this task. And risk assessment of non-communicable diseases, which will be a preventive method that India would be adopting for. Now, roadmap की अगर बात करें, in addition to that, जो national level पे intervention हो रही है, उसके अलावा जो loan है, उसको अलग अलग स्टेट्स के साथ भी शेयर की जाएगी एंड their health delivery system will be prioritized. So 7 states will be provided with the loan that include the state of Andhra Pradesh, Kerala, Meghalaya, Odisha, Punjab, Tamil Nadu and Uttar Pradesh. Now 500 million public health system for pandemic preparedness program will support government efforts to prepare India's surveillance to detect the reporting of any kind of epidemics or potential international concern. Because if you see what we have learned from COVID-19, that the prevention and even the part of infrastructure and amenities was not there. That has even resulted to a lot more infections and high rate of death that was reported across the globe. और इंडिया की बात करें, इंडिया में भी ड्यूरिंग सेकेंड वेव देयर वर लॉट मोर डेथ. तो प्रिवेंशन मेथड्स या फिर प्रिवेंटिव हेल्थ केयर इंफ्रास्ट्रक्चर डेवलप करने के लिए पब्लिक हेल्थ सिस्टम फॉर जो पेंडेमिक प्रिपेयर्डनेस प्रोग्राम है दैट विल बी फंक्शनिंग. इफ यू आर राइटिंग स्पेसिफिकली इन मेंस पेपर, then you can use this as an example. Now, India's performance in health has improved over time. Definitely, after COVID-19, government has taken a lot more proactive decision, which has helped to improve the healthcare sector. According to the World Bank estimates, India's life expectancy at 2020 was 69.8 from average 58 in 1990. तो ये चीजें improve हुई है and the higher average of the country in the national income. Under 5, अगर mortality की बात करें, this is 36% of 1,000. Infant mortality is 30% of per 1,000 and maternal mortality rate, we call it MMR, right? IMR is this. It is 103 per 10,000 life, which will be close to like average of Indian income, right? So this is lakh 103. So these data is again important. Specifically, this is relevant for your mains examination. अगर आप mains के examination में appear कर रहे हैं तो आप इस तरह की चीजों पे जरूर से ध्यान रखें, because there can be a question where you need to highlight the important facts about India's healthcare sector. Moving to the other news, that is World Bank report on freedom at workplace, something important for general studies paper 1, that is role of women organizations, population issues and issues related to poverty and development. Right? We'll see the detail what the World Bank has to report in terms of gender equality. So World Bank in its latest report, the report was titled as Freedom at Workplace. It found and highlighted that the Indian laws made little progress in improving the part of gender inequalities. तो इंडिया में अभी भी gender equality जो है वो higher rate पे. So the inequality is on the higher rate compared to men and women. The India's score in this context was 74.4. The World Bank index on women working out of the possible 100, right? तो जो रैंकिंग की जाती है वो 100 की पॉसिबिलिटीज में की जाती है. और इंडिया में जो ये सर्वे हुई है that has calculated only for city Mumbai, because the World Bank has viewed the city as a main business city और consideration यहाँ से ही average निकाली गई. Now more about the report. Globally, women have 77.1% of the legal right that the men have, and just half percentage the point from 2021 score. And India has scored like higher than 63 on the average of South Asia's region, and lower than Nepal with the region highest 80.06. तो नेपाल से हमारी performance काफी खराब है, and even Nepal is in 80.6 where India is only at 74. Now 190 economies has covered in the index. 14 scores और parameters बनाए गए जिसमें Belgium, Canada, Denmark, France, Greece, Iceland, and even Ireland, Latvia, Luxembourg, Netherlands, Portugal, Spain, and Sweden are the top 14 performance country with a total score of 100. मतलब वहाँ पे पूरी gender equality बताई गई. Now, concern for India, definitely there's a concern that World Bank Freedom Report has said that India lags behind the laws that affects the women play, pensions, work, even having a children constraint for women starting a work, business, and gender differences in property and inheritance. So this should be immediately taken care of, because ये जो global reports होती हैं, they take into considerations what is the context that is ongoing, what is government rules and regulation, what are the people response in that context, right? So that is something that is only going to have a legal backing. अगर government इसमें intervene करती है, कोई rules regulations आए, then we can have in a longer run a possible change. Now, US blame Indian firm for cough syrup death, something important for General Studies paper 2 under the subtopic that is issues related to development and management of health. So something important, because we have seen that death in Gambia और भी countries हैं जहाँ पे इस तरह के issues जिम्बाब्वे में भी रिपोर्ट किए गए. According to the recent report by the Center for Disease Control and Prevention of the United States and जो गैम्बियन की हेल्थ अथॉरिटीज है, दोनों ने मिलकर ये कहा है दैट जो डेथ रिपोर्ट की गई थी गैम्बिया में, सो द सिरप दैट वाज देयर was something found that were main reason behind the death of the children. कुछ केमिकल उसमें पाए गए ऐसे जो कि मेन रीजन थी बच्चों की डेथ की. The syrup manufacturers was India based Madden Pharmaceutical. In October last, the World Health Organization has alerted about the cough syrup which is manufactured by the Madden Pharmaceutical, और ये सब स्टैंडर्ड क्वालिटी की बताई गई थी बिकॉज दैट हैज लेड टू द डेथ ऑफ मेनी चिल्ड्रन इन गैम्बिया. Now, finding of CDC report की अगर बात करें, Center for Disease Control and Prevention, it's apex body of US that take care for entire health activities. So it says that the medication contained DEG. DEG का मतलब diethylene glycol या फिर इसे ethylene glycol भी कहते हैं. If you get any options in prelims examination, you can mark as a correct. So either it is DEG or EG. So it says that it was imported to Gambia, led to the acute kidney injury which has clustered to the children, right? तो इसको इस contaminated medicine को यूज करने के बाद acute kidney की injury देखी गई and further which has led to the death of children. The patients with DEG poisoning can experience a range of symptoms which include alterated mental status, headache and gastrointestinal symptoms. तो ये सारे कुछ problems हैं जो कि diethylene glycol के problem से हुए. Now, there's an important report about the diethylene glycol outbreak that the manufacturer was suspected of substituting DEG in place of more expensive pharmaceutical grade solvent. A report has also found the evidence of linking cough syrup manufacture to India. Definitely, this was manufactured by India only. And earlier, the World Bank organization has said that it found that the DEG and EG2 industrial chemical is tested in the sample with 1% to 21%. तो ये वेरिएशन बताई गई है फाइंडिंग्स में, किसकी जो रेंज थी वो 1% से लेके 21% तक वेरी करती है. Now, this was a claim that was made by the international agencies. Now, what will be India's response in this and what the government of India has responded? So the government of India, however, has maintained that the sample collected of the pharma companies were exported from Gambia was no contaminations. There was no contamination that was found in the part of the investigation by the government. And Union Minister for Health, in a reply to Lok Sabha, has said recently that the cough syrup has declared to be of standard quality. Again, see, the government will defend, but if our international agency is claiming something, we cannot ignore that as well, right? So sample were found to be negative in both diethylene glycol and ethylene glycol, which in a written reply, the Minister for Health has said. Now, moving to the editorial of the day, that is clean tech as a next big thing in the rural India, something important for General Studies paper 3, that is achievement of India in science and technology, Indianization of technology and development of new technology. And the same article is important for General Studies paper 2, that is conservation, environmental pollutions, degradations and EIA. So what I'll be discussing under this editorial, the theme is distributed renewable energy and how it is augmenting the life of the rural people, the livelihood, especially the women's. And about the distributed renewable energy, potential of distributed renewable energy और क्या क्या required intervention की जरूरत पड़ेगी इसके लिए. So the clean energy solutions are transforming women livelihood as a grassroots level. अगर बात करें clean energy solutions की, this is not only providing a livelihood options but also providing sustainability to the environment as well, right? So solar energy refrigerations, अगर solar energy refrigerations की बात करें, उसके अलावे silk railing machines, बायोमास बेस्ड कोल्ड स्टोरेज, ये सारी ऐसी चीजें हैं जो कि डिस्ट्रीब्यूटेड रिन्यूएबल एनर्जी के थ्रू वुमेन्स यूज कर रही हैं फॉर देयर लाइवलीहुड एट द ग्रासरूट लेवल. द वुमेन फ्रॉम द रूरल इंडिया हैज अडॉप्टेड अ क्लीन एनर्जी बेस्ड लाइवलीहुड टेक्नोलॉजी टू कैटलाइज द बिजनेस. तो ये कुछ ऐसे सॉल्यूशंस हैं जिन्होंने वुमेन्स को स्पेसिफिकली फॉर द रूरल एरिया वुमेन इट हैज एक्चुअली हेल्प देम अ लॉट. Now, distributed renewable energy की अगर बात करें, this is again something important for your prelims examination also. Now, distributed renewable energy systems are the power, cooking, heating, cooling system that generate and distribute service independently और ये centralized से link नहीं होती. Distributed renewable energy is a power technology that provide additional advantages to women for a micro entrepreneur by enhancing to the opportunity and mechanism. So rural areas में बात करें solar distribution renewable energy की काफी ज़्यादा potentials है. And even the women find several gender assigned manual activities to their. A recent study which was made by the Council on Energy, Environment, Water has found that out of 13,000 early adopters of clean energy tech livelihood options, more than 80% are women. So this is something very important in the context and in the time where we are moving toward transition और गवर्नमेंट ने कई ऐसी प्रपोजल्स रखी है जहां पे ये सारी चीजों पे बात की जा रही है. Now the potential of distributed renewable energy. By 2030, India is expected to see 30 million of women-owned micro, small and medium enterprises employing 150 million people. Distributed renewable energy livelihood options are there, जहाँ पे 500 billion की market potential है. Along with that, India has a potential to transform livelihood options for women at their core transitions. You can see women actually using the part of some solar-related machinery, and even that is actually helping. Even cost effective is there. There are less number of pollutants, and they do not require any other problem, right? So the point is that the potential distributions of renewable energy is not only confined to a rural areas, but urban areas के साथ साथ rural areas के लोगों को भी पूरी benefits मिल रही है. And the India's target for 2030 will definitely be achieved if we are excelling on this part, और इसकी जो reachability है अगर उससे बढ़ाई जाए. Some required intervention that will be there, essentially required by the government. First is to achieve the potential outcome of distributed renewable energy. There's need to have a reaching rural area as a part of livelihood initiative. First is to leverage the experience, जहाँ पे ये कोशिश की जानी चाहिए कि जो DRA के applications हैं वे women's को एक lower risk aptitude या social reasons को ध्यान में रखते हुए बनाए जाए. And the outcome of the challenge technology provides leverage users with potential outcome becoming a demo champions, and these products should be given a hand-on product with a lower credibility. तो कोई ऐसे डिजाइन, कोई ऐसे प्रोटोटाइप अगर डिजाइन बन रही है तो वो वुमेन को फ्री टेस्टिंग के लिए भी दी जा सकती है, so that they can be aware how it actually function, what are the SOPs that is involved in operating that particular equipments. The second is to organize hyper local event demos. तो डेमोज एक अवेयरनेस भी लोगों को देगी ताकि पीपल को ये पता चल पाए कि किस तरह से उसे यूज करना है, क्या क्या उसके एडवांटेजेस होंगे. Third is easy finance option. See, finance is a one major bottleneck for the rural people because they are less in the crunch of cash, right? So limited avenues हैं उनके पास. तो अगर गवर्नमेंट इसमें कुछ एड करे, क्लीन टेक्नोलॉजी remain still a bottleneck for the rural people. Financing is something very important जो कि माइक्रो एंटरप्रेन्योर्स को भी काफी हेल्प करेंगी टेक्नोलॉजी अपग्रेड करने में एज अ कोलेटरल एंड इवन टू द एप्लीकेशन प्रोसेसेस आल्सो. फोर्थ, इट प्रोवाइड जो हमारी बैकवर्ड और फॉरवर्ड लिंकेजेस की मार्केट है उसे सपोर्ट करने की जरूरत है. Many rural people have a large market potential, finding it difficult to connect to the proper consumption hub, and even in urban areas equally important for the higher incomes. So to generate higher income, we need to link both backward and marketed linkages. This will help not only for the supplier but also for the manufacturers and the end users. तो अगर ये दोनों चीजें में coordination होंगी तो इसके benefits जो पूरे hierarchy work कर रही है उनमें देगी. The fifth as last, that enable the policy convergence when no private sector entities has kind for the scale situations to leverage their reach and imperative to the exponential scale up. Multiple ministries are working towards promoting the livelihood options, जहाँ पे states के जो rural livelihood missions हैं, चाहे वो horticulture की बात करें, agriculture departments की बात करें, micro, small and medium enterprises, and even the Ministry of Textile are working towards promoting it in different sector across the country in different domain. So they should be empowered with the clean solutions energy, where their respective programs and outcome must be appreciated. And the finance part, right? The finance part is something that is important, that should be taken care of. तो फाइनेंस की अगर इश्यूज की बात करें उसे गवर्नमेंट को ध्यान देने की जरूरत है. एंड इवन द सब्सिडी कैन बी प्रोवाइडेड, राइट? तो सब्सिडी विल डेफिनेटली हेल्प इन द लॉन्गर रन. Now, moving to the MCQ questions of the day. Before I proceed, just to tell you the answers of yesterday questions. For first question, the correct option is A. For second question, the correct option is C. Today's MCQ for practice is like corning sickle cell. Which of the following is correct? The sickle cell is something affecting the hemoglobin. Symptoms of the sickle cell caused by the sickling of the white blood cell. Sometimes a direct question from biology is asked in the examination. Second question is about the Artemis Mission 1. It's created by the mission NASA and it aims to build a human presence in the moon. So do check it out for the correct option. This was all about for the daily news and editorial analysis followed by the MCQ questions. If you have any other concern, you can reach out to us. We'll be more than happy to assist you. Time being, I'm signing off. Thank you so much for watching this video.